All right, we're an accredited lab.
Yes, sir.
And the National Board for Accreditation of Laboratories accredits us every year.
Nice.
They come, do an audit. In fact, we're expecting our accreditation again to be repeated. So every year they come and check on us.
Find out the quality.
Yes, and we used ISO 15189, the latest version. International standards are met with. Okay? Most of our lab is audited, and most of our lab is automated. There are just a few tests that we do manually. Everything else is automated.
Yeah.
Okay?
How is the rate daily?
We are what is classified by the accreditation committee as a medium-sized lab. A medium-sized lab basically does more than 200 tests a day.
Daily?
Yeah, more than 200.
More than 200.
Less than 600.
Less than 600.
Okay? And basically we do tests for the hospital patients.
I see.
We don't get too many from outside. We cater to what the hospital requires.
According to the doctor's requirements.
Yeah, as whatever the patients require in the doctor's order.
I see.
We do that. And this is the hematology section that we are in. That's the 5 parts counter there.
Yeah.
That's a backup machine for the 5-part counter.
Okay.
In case it's not functioning, we can always do that.
All right.
And the rest of the here is the heart of the lab, the typing, reports are typed here and all.
Great.
And we have a system, the software, the minute we approve, one of the pathologists approve the report, it is sent into the software and it's visible all over the patient care area. For the doctors, they can look after it over there.
Great.
Okay?
Nice.
The checks that we have here is the test is done. Then one of the senior technicians checks that the results are okay.
And approved.
And no, final approval is done by the pathologist.
Pathologist.
So the pathologist will come, sit at the computer, and approve every test results. Okay? So we have a 3-system checking over here.
ورحمة الله وبركاته. نحن الآن في المختبرات الطبية. طبعا مثل ما تفضلت الدكتورة وهي عضو في المجلس الهندي طبعا تقييم المختبرات الطبية. المختبر يعتبر من أفضل المختبرات، حاصل على الشهادة الوطنية في المختبرات الطبية على أنه من الأفضل المختبرات على مستوى الهند. كذلك من أفضل المختبرات على المستوى الدولي، حاصل على شهادة الآيزو، ويوجد به جميع الآلات المستخدمة حديثا في الفحص الطبي. Nice to meet you, Doctor here.
Nice meeting you too.
Let's go and move to the other side.
We'll go to the other section. This is the biochemistry section of the department, and we do all the biochemistry over here. We are unique in that we do dry biochemistry. We don't do wet. Dry. And that is the vitreous machine for which we do the dry chemistry on. The advantage of the dry chemistry is that everything comes in a little cartridge. There's no worry that a technician can make a mistake, and each parameter is done directly in that little cartridge,
so
and then we dispose it off.
The blood drop will be dried already?
Yeah, no, the blood drop is it suctions it in, puts it in there, and the report comes out. The evidence of that is that we have an external quality assurance program, which is run by the Americans, BioRad it's called. And for the last 1 year, we haven't had a single report. Every month they send us a sample. We do the chemistry on it and we send it to them.
Yes.
And they compare our results, and if the result is wrong, it's called an outlier.
I see.
Now, for the last 1 year, we've never had an outlier.
Perfect.
It's a perfect score for 1 year.
Granted.
Okay? So that's the biochemistry. This is the mini vidas. We do our serology and hormones over this. We do all our immunology on this too. Okay? This is also automated. Again, you put in a cartridge.
Yes. That's all.
And that's it.
And wait for the results. Great.
Okay, but all these results get approved by the pathologist later on.
Sure.
Okay.
You are the one who will write
yes.
and sign the report.
Yes, we'll sign the report.
If you like to approve it, or you will send it back.
We get repeated sometimes. Yes, very good reassurance. We monitor how many times we repeated a test in a given month. We have about 17 quality indicators for the lab.
Analysis.
We analyze at the end of every month and send a report in. We do that because the NABL, when they come to audit us, they want to see those.
Good.
And check our reports.
Great.
Okay.
Great.
So we do all that. And that's just for making good water. Yeah, that's a water purification plant that we have. And we have a little electrolyte machine over there for doing electrolytes. So it's all automated again. And we have what we call an internal quality control program, which we do every day. Before we start, we have known values. We check that the machine is working well. And then every month, we have an external quality. The outside sample comes, and people outside check our results. So that is true for every parameter we do in the lab. Okay?
Excellent. نواصل الحديث مع الدكتورة عن المختبر وأقسامه والأدوات والأجهزة الموجودة فيه. طبعا نتحدث الطبيب عن قسم يسمى البايوكيمستري اللي هو كيمياء الدم، وتعرفنا على تفاصيله. وعندهم أجهزة جديدة حديثة، طبعا آخر الأجهزة الحديثة من ضمنها جهاز ما شاء الله قمة في الدقة، حتى أنهم متعاملين مع بعض المعامل الأمريكية فيرسلوا دائما بعض العينات بالتأكيد. فما حصل عندهم ولا يوم أنه عندهم أي مشكلة أبدا، كلها نتائجهم تحتوي على دقة عالية، وهذا ما يخلي المختبر داخل مستشفى درمشلة من أفضل المختبرات على مستوى الهند طبعا، وكذلك على المستوى الدولي، بوجود طبعا الدكتورة الأخصائية، وهي مثل ما تفضلت عضو في الجودة بدولة الهند الشقيقة.
This is the histopathology section. This is where we make all the tissue diagnoses. We do histopathology and cytology. All right? It is automated. We have an automatic tissue processing machine over there.
Automatic?
Tissue processing.
Yeah.
It takes overnight tissue processing to process it further. Then the technician comes in the morning.
Collect it.
He takes it out of the machine. Then we embed the tissue in paraffin wax and process it, and the cutting is done in the next room. I'll show you where the cutting is done. In this lab, we also have an automated immunohistochemistry machine. We can talk about that later. Those are very highly specialized tests we do on the tissue. All right?
This is after the operation done or before?
It is some of it is before to make a diagnosis. Some of it is after the specimen comes. We analyze it and we give the pathological stage of the tumor.
So we can call
how many lymph nodes, how many margins are clean, things like that.
So it is highly professionalized lab for cancer treatment.
It is the heart of cancer treatment. Yes. The diagnoses are made here. The final staging is done here, so that the clinician knows what they're going to treat the patient.
نكمل زيارتنا لقسم المختبرات الطبية. نحن الآن في مختبر متخصص بالنسبة لفحوصات السرطان، خاص بأمراض السرطان، به الأجهزة الحديثة المتطورة العمل اللازم. طبعا المختبر يستقبل العينات من الأطباء، بعض الأحيان يكون قبل العملية، وأغلب الأحيان يكون من العملية. تأتي العينة إلى المختبر، يتم فحصها للتأكد من وجود السرطان من عدمه. إذا تم إنه خلاص السرطان انتهى، تم إزالته بالكامل، يتم تقرير داخل هذا المختبر، ويتم كل الفحوصات يتم اعتمادها من قبل الدكتورة بالذات. كل التقارير تمر عن طريقها هي المقرر في النهاية. هذا المختبر مهم جدا بالنسبة لعلاج أمراض السرطان، يحدد مصير المريض، هل السرطان لسه موجود أو لا خلال العملية. طبعا إذا كان خلاص تم استئصاله انتهت العملية، إذا كان متبقي شيء يتم استكمال العملية وإزالته بإذن الله تعالى. Thanks, doctor.
Okay.
Let's move to the other side.
All right. Okay. This is the automated immunohistochemistry machine. These are highly specialized tests we do on tumors. To one, diagnose exactly what cell the tumor originates from. Two, we have what are known as prognostic markers that we can do on this machine. The sections tell us how far the tumor
Going in the
staging it. It also tells us a little bit about how it will behave. We have specialized antibodies which on the tissue section give a special color, and I can tell the clinician how the tumor will behave. Is it aggressive? Is it not so aggressive? And these antibodies help do it.
help to
Diagnose that. So it's very important in the follow-up treatment of the patient. Very important in breast cancer, where I can tell the clinician almost which drug to use. Is it HER2? Yes, breast cancers. HER2 new positives, the targeted therapy, so that I can tell from here. So these we use for special targeting, and not so much confirmation as special targeting of therapy.
Targeting of the therapy, okay.
Receptor studies in breast cancer, other receptor studies in other cancers like lymphomas, we have receptor studies.
Okay. So where we have to focus the treatment to?
Yes, there's a special molecule. If it is positive on section, that molecule will go hit the cancer cell.
Okay.
So it's useful.
نحن الآن مع آخر الأجهزة المتطورة في تشخيص مرض السرطان. هنا الطبيب تتحدث عن جهاز يعتبر من القلائل الموجودة في العاصمة هنا في دلهي، وبما أنه مستشفى درمشلة متخصص في علاج أمراض السرطان، هذا الجهاز يساعد الأطباء في التشخيص مكان تواجد السرطان بالضبط. هل هذا السرطان عنده انتشار أو فقط في منطقة معينة. هذه الماكينة خصوصا لهذا الشأن، فلذلك يعتبر مستشفى درمشلة من أفضل المستشفيات في الهند في علاج مرضى السرطان. لذلك المرضى من كل مكان ما شاء الله متواجدين هنا، وتواجد هذه الكوكبة من الأطباء الاختصاصيين ذوي المستوى العالي من العلم. ويكفينا ما شاء الله الدكتورة معانا هي أخصائية أمراض دم وراثية، ومثل ما تفضلت معاكم سابقا على أنها هي في ضمن طاقم تفتيش الجودة للمختبرات الطبية على مستوى الهند، ولهم الفخر في ذلك. دمتم في صحة وعافية، ونلتقي بكم من جديد. Thanks, doctor.
This is the automated blood culture machine with which I can give reports for blood cultures within hours rather than 24, 48 hours later. It's highly sensitive for any infection that is there in the blood. Similarly, we have here the Vitek machine, which is for automated sensitivity. It gives very quick reports on which bacteria are sensitive to which antibodies. It's all automated in here. And that way, very quickly, the doctor can hit the patient with the right antibody.
I see.
This is sensitivity machine, Vitek for automated systems.
To discover the bacteria.
Yes, for the bacteria.
جهاز أمراض الدم الوراثية، وطبعا سريع. خلال وقت بسيط تحصل على النتائج خلال ساعة واحدة، أقل من 24 ساعة، مش مثل الأجهزة السابقة المستخدمة في هذا الشأن اللي تأخذ لك يومين و3 أيام و4 أيام. على طول الطبيب يحدد الأمراض الوراثية اللي ممكن المريض يعاني منها. وهنا عندنا الجهاز اللي هو يختص بالبكتيريا لفحص البكتيريا، أي بكتيريا مقاومة للأدوية، وهو نفس الشيء سريع من الأجهزة الحديثة. لذلك يعتبر المختبر في مستشفى درمجلة من أفضل وأرقى المختبرات على المستوى الدولي، مثل ما هو حاصل على شهادة الآيزو.
This is where we plate all the bacteria that grow there for further studies. Whether we want to do sensitivity in the other machine, it goes from here. Whether we want to do other studies on them, we do it from here. And this is where this is automated. It's a laminar flow, and all sterile equipment is kept in this to work on. Okay, and you can see the blood cultures. The samples are there. Whether we use blood cultures,
like like a farm, like a farm.
Well, actually no. Yeah, they come. Sometimes when the blood cultures, the bacteria have grown there. To further identify which bacteria is it, we come here.
For how long they will keep it? For example, 1 day, 2 days.
It depends. It depends on the bacteria, how much information we can get. And any culture we do it for 24, 48, 72. If it's up, we do 3 reports. And sometimes it takes 72 hours to do.
So it seems like it's like a farm of the lab.
Well, sort of. It's sort of like that.
مثل ما معلوم أن مرضى السرطان يكون عندهم انخفاض في جهاز المناعة، فلذلك يتعرضوا بسهولة للعدوى البكتيرية وللعدوى طبعا الطفيلية، الفيروسات. عشان كذا هم عاملين حسابهم لكل النقاط هذه، بما أن المستشفى متخصص في علاج أمراض السرطان.
Now for diagnosing cancer, we take the tissue sections from the histopathology, they come to us, and we report on a multi-headed microscope. Okay? Because internationally and all, it's always preferable if you're going to give a cancer diagnosis that at least 2 experts look at it and come to the diagnosis. So here, I'm always there, and one of my colleagues, she was sitting with me, they are always there. So all slides are signed out by 2 pathologists, whether they're cytology or histopathology. So right here we have a confirmation. Also, we participate in external quality programs with All India Institute of Medical Sciences. They send us an unknown, we make the sections, we send our sections, they look at that it's well done, they score it, and we give our diagnosis. And they confirm it or not confirm it for us. So we have an external quality assurance also in ours, with multiple other systems that we confirm our diagnoses with. And then of course in the tumor board, we sit, I'm there, and we discuss the diagnoses. So if there's any doubt in it, we can always bring the slide back and re-look at it. Because it's a very important thing. All treatment will be based on this. All right? And from here, we also order the special tests that I showed you, the immunohistochemistry. Those get done, we look at them again. With those in knowledge, we give out the final big report. So we keep adding frozen section to H&Es to immunohistochemistry. This is the way we go on our treatment.
إعداد التقارير الطبية فيما يخص أمراض الدم الوراثية جميعها، خصوصا فيما يتعلق بمرضى السرطان. ومرضى السرطان لا يطلقوا عناية خاصة حتى يتم التشاور بين الأطباء بعد الجلوس على هذه الطاولة، يعد التقرير المناسب، وبإمكانهم كذلك أخذ استشارة من مستشفيات أخرى بإرسال عينة وهمية بدون بيانات حتى يتم التأكيد على أنه المريض يعاني من مرض السرطان أو لا، أو في حالة أن المريض تم استشفائه يتأكدوا منه أنه تم الاستشفاء تماما أو لا. هنا الغرفة وهنا الإعداد الأخير للتقارير، اللي بعدها يتم إعداد الخطة المناسبة لمريض السرطان للعلاج.